Tom O'Callaghan is the CEO and founder of the iHEED Institute. He's a doctor with 20 years experience working in family and community health in Ireland, and he is the founder of the Living Health Clinics. He's also, interestingly, involved in the sort of further training in high altitude and sort of expedition medicine, and he's been strongly involved in sort of ICT solutions in terms of community health within the Irish sort of global health community as well. So over to you, Tom. Thank you.
The good news is I'm going to be brief. Jean-Pierre was feeling, when I heard Linda, you said you got upgraded in your position, so Jean-Pierre is feeling pretty bad as the last. If it's an order of seniority thing, I was feeling pretty, I did offer to swap with him, but he felt maybe the last person might be remembered because they said something interesting. So I just want to give 10, I'm not going to speak about a specific project, I just want to give 10 I suppose, lessons I've learned the hard way over the past few years about public-private partnerships. The first one is really, many of the issues we're trying to address here, and they've been very well described by Magnus and others, are very complex, and we really do need to introduce new approaches that bring together multiple stakeholders. And this is very difficult and very slow and involves complex negotiations across, as Magnus very well described, mobile operators, NGOs, academic partners. And that's difficult stuff to do. The second thing I'd say I've learned about public-private partnerships is everybody's talking about them, but very few people are really doing them very well. So I think if it's a skill you could engender in your organization is the ability to really understand how to do partnerships well. What are the success stories of how to do partnerships? I think the second thing I've learned about partnerships is it's very difficult to get money off anybody, be that a donor, be it a corporate CSR, or be it business units within corporations. And really, you know, predominantly the group here are from implementing NGOs and research organizations. And just because what you're doing is right and you know it's right, don't be so naive to believe that those you're meeting and talking to actually care. That's the reality. And I suppose what I've learned over the past number of years is it's probably easier to raise investment funding for a for-profit business than it is to raise funding from the donor sector. It's really important to understand that the time from the beginning of negotiations to the time of actually concluding negotiations on donor funding is really a cycle of about 2 years. So it's that length of time it takes to build the relationships, to get to know the individuals, to write the proposals, to get them approved, and to get money into your organization. So if you have an idea, you really have to look in terms of that kind of time frame. The third thing I think I've really learned about public-private partnerships is everybody thinks partnership's a good idea as long as they control the money. As long as I have the money, I'll partner with anybody. And it's really important to set out clear expectations of who's responsible for what, who's getting paid for what, and that kind of skill of project management is really difficult to do, and people setting out those clear timelines, objectives, outcomes, etc. And really important to get the expectations right, that everybody understands what the expectations are, what the outcomes are going to be. And a great example of that, I think, is in Google. I do a bit of clinical work in Google here in Dublin, 1 day a week. And in Google, they have this thing called, I don't know if anybody's heard about it, it's X10. So if you go to a meeting in Google and you say, look, I've had this idea that we should do this, and they go, great idea, but multiply it by 10. Think 10 times bigger. So what do people in Google do now? They divide by 10 before they go into the meeting. So they divide their idea, go in and say, I have this little idea, and say, X10, and they go, right on the mark. So you know, it's about expectations. The fourth thing I think I've learned about public-private partnerships is, when we're here in Ireland, it's really is a small place, okay? So the partners you're looking for, and there's a limited pool of money after the economic recession, the partners you're probably looking for aren't here in Ireland. They're predominantly in the US and they're predominantly in Europe. I'm just back from the Far East and the Middle East, and you know, we all talk about China and partnerships in China, but you know, first of all, there's huge different cultural variations in terms of philanthropy and corporate CSRs in these new geographies like India and China and Africa, where there's a lot of new money. But the second thing is to realize is they don't even know where we are. You know, they don't even know where Ireland is. You know, in large parts of China, people don't even know where this country is. So you're talking to somebody who doesn't even know what country you live in or where their country is, or you know. So I think not to have an over-exaggerated view of ourselves in the world. I think the fifth thing I think is really important is the private sector really means business, and it's been described quite well by many of the people in the panel. But ultimately, their interest, private sector is really interested in the bottom line for their business. They may be interested in research elements and in terms of working with research institutes to actually prove their bottom line, improve their objectives. But you need to be, as a research institution or as an academic partner, you really need to understand that so that when you go to the table, you really understand very clearly what they're looking from you, and that you've really done your research about what is their bottom line, so that when you go to the table to have that conversation, they know that you know who they are, what they do, and what they're looking for from you. The other thing is, I think, really important is the ability to listen, listen, and listen. And I'm a medical doctor, and doctors are not very good at listening, and I'd hold the same to academics. You know, we're not good at listening, so if you're looking for money from somebody, you really need to understand what it is they want from you. And somebody gave me very good advice. They said, if you want money, ask for advice. If you want advice, ask for money. So the best conversations are when you go and you never talk about money. You talk about, I would like your opinion about how I could benefit your organization through the work I'm doing to achieve your objectives. And listen, 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 and hear what they want from you. The other thing I think we need to do is we need to be very niche. So we need to pick particular areas and particular sectors in Ireland where we develop public-private partnerships. It's very hard to be good at everything, and Ireland is a very small place. And I think a good example of that is if you look at the global health community in Ireland, and you look at, say, Johns Hopkins as one institution, there are 250 global attendings in Johns Hopkins in one institution in America. So it's very hard for us to compete as, you know, a sectoral expertise across all these verticals. So we need to be a niche player in particular areas. I think the other thing then is it's all about the data, it's all about the evidence, and you must be able to prove your ability to your case on return on investment. If I give you $1, if I give you €1, what's my return on investment? Can that be multiplied by co-investment, etc.? And I suppose two last points. One is that make it easy for the person who's sitting in front of you not to go somewhere else. Most people you meet are trying to help you. Most people want you to succeed. And if you give them any inkling of hope that you can deliver for them, they'll try and work with you. But it's really important that you're well informed to help them, and that they understand when they sit down with you that you really understand who they are, what they want, and how they can help you. And I think my final point is in all of these relationships, public-private partnership relationships, it is all personal, and it takes time to build those relationships, and that personal relationship is the most important thing. Magnus spoke very well about it, in particular to that community health worker training program using mobile technology. Leslie Ann Long heads up a very successful group called Empowering Frontline Health Workers. It'll be the subject of some discussions next week at Get Health Summit, which will be held on next Thursday and Friday in Dublin Castle, and you're all very welcome to attend as the guests of iHEED if you just let the guys know out at reception if you want to come. But it's all down to the individual and to the relationships and managing those little things. It's those little things that count, those personal relationships. I think someone was talking about it this morning. It's the meetings between the meetings, the discussions between the discussions, and for sure Guinness works. Thanks.
Okay, well, thank you for Tom's top 10.